But then come beginning of 2019, I had a cycling accident, and that put me out of life for a year. There's a lot of things I shouldn't have, quite miraculous. So one, surviving. Two, my spinal cord injury is incomplete, and that means I've still got some movement in my legs, which I use to operate the drills. I shouldn't have my right eye. I think there was a fracture in my right eye socket, and the surgeon that saw me said the two people before me with the same fracture couldn't see out of the right eye. So if I didn't have my right eye, I wouldn't be able to practice either, no depth of field. And then I shouldn't have my brain. I think Meg was told, 3 or 4 months post-accident that I would still need to have assistance every day because of my brain trauma. I had severe post-traumatic amnesia for 30 days. Over 30 days, which meant that I shouldn't have, the level of cognition that I have.
And then I think when the accident happened, we kind of felt the accident happened and then receptionist wanted to quit, and so we kind of felt like we wanted to step in and support like everyone as well as the business. We kind of didn't want to see it just like fade away after all the years that mum and dad had spent building it up and like putting all their like effort and perseverance into it. And
the backstory is 3 weeks before my accident, Tiff was diagnosed with cancer. And she needed time off. We didn't know if the businesses could continue because,
I think Tiff was just also saying to me that she's going to be sitting in and do the receptions. And I was just saying, well, she got treatments as well. So I was like, a family member's in need, you just do what you can. And I was just like, I can just sit there. And my background was in nursing, so that's probably the link of health. And I think from that time I was a bit more like a sounding board for mum, more or less, because she have both of her kids who in needs of great medical health. The business needs a bit of kind of support, so that's how I was helping.
I think dentistry was a huge part of me coming out of that and healing. I remember all the way through, I thought I had to give up dentistry, I thought it wasn't possible to get back to work. But I remember sitting down for surgeries, my brain would kick into another gear. That was a huge part of my recovery.
But I think in the midst of 2019 and everything that had happened, I think, there had been so much hard work and investment into it, and then it was blessing the community in such a way that, it would have been, hard to see it.
Yeah, so it's not just, obviously our family was going through difficult times, but there's other families who works there and depend on their livelihood as well. It's not that we provide everything, it's just that that's another hurdle for them as well. Everyone's just putting a lot of effort for it to work as well, and the patients as well. They were very gracious and forgiving of kind of the schedule changes and all that stuff. But I guess it was just more than any individual or a family. It was just the business was part of the community in that sense. So I was being very grateful for that. And I guess that attitude has really helped me to kind of even though I don't know much about dentistry, I'm going to give it more than my best and just ensure that the staff are well looked after, because you don't know what kind of people you're helping. I think the legacy here is that you don't know what kind of fruit or seed you plant by genuinely helping a patient. I'm just wow, we don't know if we do our job well, we don't know what contribution we make. We need to kind of stick together in that sense. We need to care for one another. And I think mum and dad do that all the time, so they care for us.
But I think it's so good that both of them, they take it up and carry on what we've been doing, and good for the patient, things like that. So it's give me a lot of pride, joys.